Good evening, everyone. I'm going to be presenting for biomedical ethics. I am using case 1 and case 3 from the UNESCO Digital Library, and my focus for this presentation will be on the responsibilities of the healthcare professional and or responsibilities of the patient. So we'll be looking at case 1 first. Case 1, treatment without consent, refusing medical treatment. We look at the case of Miss EB. Miss EB is a 28-year-old woman who has been afflicted with severe cerebral palsy and is a quadriplegic. Her new condition makes her immobile and she is completely dependent on others. She also suffers from degenerative and crippling arthritis. She is in constant pain. However, she is very intelligent and competent. Her weight hovers between 65 to 70 pounds. She is normally spoon-fed, but doctors inserted a feeding tube against her will. So, here are some things to consider. Miss EB is a quadriplegic with no apparent family ties. She is completely dependent on others for support. She is mentally stable, but she is in constant pain. So her attempt to starve herself was her decision. The doctors decided to give her a feeding tube without consent. The autonomy of the patient has not been respected. The doctors are trying to create beneficence and non-maleficence by giving her nutrition through a feeding tube. This is through their perspective. Right? She has palsy and arthritis. So these are irreversible conditions. There's no way to cure these conditions. So by continuing to force feed Miss EB, the doctor will only prolong her suffering for another 15 to 20 years. She's not at risk at dying from these injuries very quickly, but the doctors will only prolong her suffering for another 15 to 20 years if they continue. Now, the doctor has a right to act in accordance with their own conscience and beliefs, though it may conflict with the autonomy of a patient. That being said, the patient has the right to refuse treatment even in the cases with extreme consequences. So, let's look at possible solutions. Possible solutions that could arise from this would be taking out her feeding tube and allowing her to die in accordance with her will. Now, this may sound like a pretty morbid answer, but Miss EB has expressed through wanting to starve herself that she is no longer satisfied with living and she wants to die. And even in cases where there are extreme consequences, the autonomy of a patient, in this case Miss EB, they do have the right to ask and refuse treatment even if it means death. However, it might be against the obligations that doctors have to provide fundamental care to their patients. But that raises an important question. Is food and water fundamental care, or is it a type of treatment? The next option, send her to a different hospital for different doctors to treat her. This one would be pretty unlikely to happen because, as I said before, she doesn't have any apparent family ties. And so there would be no family that could come and sign papers for her to transfer her from one hospital to another. And it may not be good. She may not want to go either, because she's already expressed that she wants to starve herself. So because of that, she might be resistant to leaving this hospital that she's at. It would, however, potentially free the other doctors from helping in a patient kill themselves or slowly die. So it may possibly move the blame from these doctors to a different set of doctors, but does that remove the guilt and shame that these doctors would feel? And then the final option is continue to force feed her. As we said before, continuing to force feed her would completely violate her right to refuse treatment, because she has that right. And not only that, she would be suffering. So even from the doctor's perspective, they would think that they're committing beneficence and non-maleficence. But from Miss EB's perspective, she believes that they'll actually be causing maleficence, causing her harm, prolonging suffering. So the most ideal solution from these three would be to take out her feeding tube and allow her to die in accordance with her will. Then we move on to case 3, treatment without consent. Treatment despite patient's opinion. So now we move on to the case of Mr. HS. Mr. HS was visiting from a different city, and he got into a motor car accident. His hand was badly injured and he was taken to the local hospital. Mr. HS was unacquainted with Dr. M. He asked the doctor to fix his hand but not to cut it off, as he wanted to have it looked after in his home city. Dr. M was more concerned with relieving the patient's suffering. The doctor, before anesthetic was administered, decided to amputate the hand, or decided that he was going to amputate the hand. Any further delay could put Mr. HS at risk of blood poisoning, which would put the patient's life at risk. The other 2 doctors that were there supported the decision of Dr. M. So here are things to consider. Mr. HS visiting from a different city. So he would have been in a different city. He normally has a different doctor, so he was unacquainted with Dr. M. But also, Mr. HS was not the most educated, so he had trouble making an informed decision. Dr. M would have given him multiple options and talked through the different consequences that could have arisen from different courses of action before the surgery took place. But because he was not well educated, he didn't respond in any way, really. In any way. So he had trouble making an informed decision. Mr. HS advised the doctor before surgery that he does not want his hand cut off. So just before the surgery takes place, he says he doesn't want his hand cut off. But then, as the doctor is about to use the anesthetic, administer the anesthetic, he looks at his hand and realizes that it needs amputation. So the doctor uses his autonomy to amputate Mr. HS's hand. However, amputation is an irreversible process. So when Mr. HS woke up, his autonomy and refusal of treatment, those rights were violated. But if the surgery was not conducted, Mr. HS's life could have been at life-threatening risk. Therefore, the doctor believes he is committing beneficence and preventing maleficence, or committing non-maleficence. He's preventing harm from coming toward, or serious harm coming towards Mr. HS. Now we can also look at it from the court decision, because this went to a court appeal. In the court appeal, the final verdict was that Dr. M was correct in his decision to conduct said surgery. But Mr. HS would have been compensated for an artificial hand, with an artificial hand, because of that violation. Amputation is not something that you can fix. If you take out someone's hand, it's gone. So an artificial hand for Mr. HS seems like appropriate compensation. But let's look at a few other solutions. Could Dr. M, could he have recommended Mr. HS to a different doctor? He could have. He could have. But one, there's no guarantee that said doctor would have chosen a different decision. All doctors have an obligation to their patients and a responsibility to their patients to look after their well-being and to do the best that they can to provide the best care with the least amount of harm. So there's no guarantee that a different doctor would have acted in a different way to Dr. M. There's no guarantee. And Mr. HS is visiting from a different city. He's already a stranger and unacquainted with Dr. M, so that trust that comes with having a consistent doctor still would not be there if he went to a different doctor. So the same problems would probably arise. We then have Mr. HS could have been sent back to his hometown to have his regular doctor deal with it, at the risk of blood poisoning. Now, unfortunately, the only way he could have gone back quicker could have been possibly with the help of the doctors. But this is a very unlikely one, and this puts Mr. HS at complete risk of getting blood poisoning. And blood poisoning is a could have life-threatening implications. Therefore, to send Mr. HS back to his hometown would simply be putting him at risk for potentially fatal consequences. And I'm pretty sure if Mr. HS truly thought about the consequences properly, he would think that this is a bad option as well. So, what is the best possible solution in this case? I believe what the court's decision was correct. I believe Dr. M was correct in his decision because he is genuinely looking after the well-being of the patient. If that surgery does not happen, Mr. HS could potentially die. And he didn't express that he wanted to die. He just expressed that he didn't want his hand cut off. So there's an inherent obligation for doctors to want the best for their patients. But he was also compensated with an artificial hand. It's clear to see that his autonomy and right to refuse treatment were violated. They were not respected. And amputation is irreversible. He cannot get that hand back. So to give him an artificial hand seems like a relatively good solution.